Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Well, hello there, and welcome to Seven Figure Chiro. I'm your host, Dr. Jeff Berard. I'm here along with Kristin.
Hello.
So welcome to episode 20. Today, we're going to talk about when and why to scale. So scaling can be anything from adding a service to scaling a existing service you have, and there's many reasons to do that. So we'll get in and have a discussion about that. And this is actually
we want you to go back always. So either before you're listening to this episode or after you listen to this episode, go back to episodes 11 and 12 where we talked about different services to integrate and went a little bit more in depth, and then also scaling the way that you improve the way you do things in your office. So episodes 11 and 12 are going to be in conjunction with this episode.
So obviously, to become a seven-figure chiro or to stay a seven-figure chiro, you have to know when and why to scale, right? I mean, we all don't start at seven figures, so you have to know when and why to scale. And this is the whole reason why we've gotten to where we've gotten as far as our company goes is, and I'll take you through that quick journey and then we'll talk about some specifics. So, after moving to Michigan, 10 years ago, 11 years ago?
12 years ago.
Okay. Yeah. But I feel like I've been saying 10 years for a long time. So it's only been
12 years as of next Wednesday.
So 12 years ago, I started myself a front desk and a massage therapist. And obviously we've grown to 30 plus team members. So this is how I did it. And I'll skip all the details in this story, but we'll get into some of them in a little bit. We just wanted to see some traction. So with the front desk massage therapist and myself, I just started to hit, some capacity with the way I treat it. I'm not a subluxation only chiropractor. I do a lot of soft tissue, exercise, things like that. So, we reached about, I don't know, it was like 25, 30K a month. And then I was like, okay, I need to do more. Financially, I had to do more. And in order for me to do more, I had to have a bigger team. So I brought in a great adjunct to our team. I brought in an exercise specialist to help me offload that to him. And he was a fantastic personal trainer. He's still a good friend of mine. And he basically was doing the therapeutic exercise component. And so we just started rolling with that. And all of a sudden he got really busy. And that point, we hired another massage therapist because our first massage therapist was busy. So now we had two massage therapists. We had an exercise specialist. Exercise specialist was completely booked. So I said, well, geez, let's look into bringing on a physical therapist. We found a great physical therapist who joined us, and then we got all credentialed up as a group. We started a physical therapy company. We became a physical therapy company and a chiropractic company within one, and we started scaling him, and he grew. And then we hired a physical therapist assistant, and we just kind of waited for each box to fill up before we added another box. And not only did we wait for that box to fill up, but we made sure that we had efficiency and processes for each box. And that's essentially in a Cliff Note version of how to scale. Now, the why to scale would be either you want more, there's a demand for more, and here's a big one, and this is something that created growth for us, is so many people are worried about new clients. Like, we need new clients because we need more money or we need to keep our people busy. Well, just pay attention to what your clients need and what they want, because a lot of times you can service them right in your own office by bringing on another type of service that they want. Again, that's why I brought in PT, as all these people were going to PT somewhere else. Even though I was doing exercise with them, they're going to I'm like, well, that's silly. So pay attention to where your clients go throughout their day. What are they doing? Who are they seeing?
And then people love when everything's all in one roof, because it just makes it easier, and they trust that the providers are talking to one another, and so at least you're all working together and working on the same path.
So here's a
for
fact.
the patients.
Here's a fact for complementary alternative medicine, which chiropractors fall under. That is, and by the way, this isn't just complementary alternative medicine. This is allopathic medicine as well. They did a survey of like a couple 100,000 people, and what do they look for the most when it comes to healthcare? And it's convenience. And what they mean by that is patients don't like going to this doctor, and this doctor sends them across town to this one, and then this one sends them somewhere else. That's not convenient. They really, really respect and value convenience, which means if you listen and pay attention to your clients and what they need and what they want and what they do throughout their day, and pay attention to their lifestyle, many times that's how you can scale your business, by just paying attention and focusing on the lifestyle and the things that your clients do. For example, we at our business, we have a lot of athletes. We have a lot of students. We have a lot of really active people. So one of the ways we scaled, when I told you we added a physical therapy, we did all that, by the way, in 2,600 square feet. Then we scaled. We had a building next to us that's connected that we built. It was completely vacant. We just expanded the space, and guess what we provided? We provided a 3,000 square foot gym for all these athletes to engage in personal training, physical therapy, stretch therapy, acupuncture. We expanded all these services because we were listening to our clients and our customers. Here's another way we scaled. I had an acupuncturist who was referring me a ton of patients. I was really grateful. She was a good acupuncturist, and she had an associate acupuncturist with her. Her name was Courtney, and Shirley had retired. Shirley was the one referring me all the patients. And when Shirley retired, there was this void now. I wasn't seeing any more of these people, and so I said, let's think about acupuncture. And it just happened to be good timing. Courtney came to me and said, hey, I'm an acupuncturist. I'd love to, and boom, we've had acupuncture for how long?
2016,
yeah. And Courtney's doing amazing. It's super busy. It brings people in just for acupuncture. And those acupuncture patients are exposed to our massage therapy, our physical therapy, our chiropractic, all the services. So
we have people, right, that do multiple services at the same time. They don't just do one service and then like service hop. They'll see multiple providers at the same time. Or when they're done with the treatment plan, maybe they want to work with just one of the service providers on one specific thing.
So
that's really cool.
If you pay attention to what's going around in your community, if you pay attention to what your clients or patients are engaging in, and you find the right opportunity to make it more convenient for them, you will flourish. And it doesn't have to all be at once, because the next thing we talk about is when to scale, right? We said why to scale. Why is either, the box is overflowing, so you need to scale it that way. You need to add another team member. You need to add another provider. When to scale, would be, so take these lists of things that you feel your clients can benefit from, even if it's, right now. I'm not saying do them all right now, but make a list of what those are. Physical therapy, acupuncture, stretch therapy, whatever it is, whatever floats your boat, whatever
something that they kind of go hand in hand, or they at least work with one another.
So take that list and just start knocking them off when the time is right. And when you implement one thing, get it going, wait for that bucket to fill up, and then either you start a new bucket, a new service, or you scale that existing one, whatever floats your boat for your business. But that's how and why is you have to really listen. How you scale, you have to listen to your clientele. You have to see what they're doing. You have to see what they want. That's the easiest way to scale, is instead of going to get new people, pay attention to those that you have.
So let's talk about this real quick. So let's use two different examples. The first example is going to be you, Jeff, are working 40 hours a week. You're seeing, let's say, 150 patient visits a week. We'll just throw that number out there. And you do a lot of physical medicine codes. So you have two options. You work full time. You still want to work full time for the next 5 or 10 years. And your patients are going elsewhere for other services that could work well within your organization. So let's talk about maybe why you choose a different service as opposed to hiring someone that does the same thing you do. So, for instance, instead of hiring another chiropractor and you're fighting for the same patient base and the same patient type for the most part, you go and hire and add physical therapy, which is a new service that can work hand in hand with the chiropractor and their treatment plans. And then typically they're going after different patients, right? You're able to bring in more new patients because of different issues, and then they can maybe over time see each other and whatnot. So let's talk about maybe why you would choose to add a different service as opposed to adding another chiropractor, because we come across that when we talk to people in the consulting world all the time. They're super quick, like let's say they're a chiropractor, they're super quick to want to go hire another chiropractor, as opposed to thinking about adding a different service that can bring in different patients and can help the same patients that they're already seeing.
Here's a simple, everybody knows this. And when it comes to investing is, the buzzword in investing is clearly diversify, right? It's your business is an investment and you have to diversify. So, not putting all eggs in one basket. I'll give you an example. Arizona, I don't know how many years, because years just seem to fly by now, but Arizona, these chiropractors were just killing it in Arizona. Blue Cross Blue Shield, 90% of the patients in Arizona had Blue Cross Blue Shield, and they were just slamming these numbers down, and there were 7-figure chiros all over the place. And then all of a sudden, Blue Cross Blue Shield pulled out chiropractic benefits in Arizona, and they had nothing. They were just empty. Now, that's not a good situation to be in. That's not a good way to run your business. So it makes so much sense to, okay, if you're a solo practitioner, and I'm just going to give you a real scenario here. If you're a solo practitioner and you're seeing 125 a week, that's not high volume. 125 patient visits a week. Maybe it's time now where you want to hire another chiropractor because you need to spend more time working on your business and be able to service that 125 patient visits a week. So you're thinking, man, I should go hire another chiropractor so he or she too can see 125, and then I can double my revenue. And okay, that all sounds great if it comes to fruition, and it probably would come to fruition, but doesn't it make more sense to, again, this doesn't resonate with purists, the straight chiropractors out there, but everyone else, listen up, is to bring on a physical therapist. Now you can open up this whole other gamut of services that you can provide and bill for. It brings in a whole nother demographics that you wouldn't otherwise bring in, and it diversifies. So if your chiropractic benefits go kaput or whatever, well, you have physical therapy there to help support. When you hire that physical therapist, and that physical therapist now is doing the same numbers you're doing, doubled your business, now you can go back to scaling the foundation, bring on another chiropractor. Now you have autonomy to take more time off and work on your business. When your PT's full, bring on another PT. This is what we did. We have 4 PTAs, 4 physical therapists, PT. And this is just how we scaled. So your business is an investment and you have to diversify. Those that don't diversify, those that put all their eggs in one basket, and I know those that are listening right now, you'll 4 or 5 chiropractors some of these people have, and they have a couple chiropractors that are sitting on their thumbs all day long, and they're not paying for themselves, they're not meeting the standard, and that's why, because you're not diversified. So don't put all your eggs in one basket, and think about outside the box. what other services can you add to scale and diversify your investment? It
That's
makes
one of the
total
biggest
sense.
things I think that kind of got us really into Stretch Center. So I think there's two things that really, really helped Stretch Center. And one was you were stretching a lot of people in the room as a chiropractor when we could have other people stretching, right? But the other thing is health insurance does not cover maintenance care and preventative care. And then also a lot of people who are going to PT, they like didn't want to end their PT treatment sessions, but insurance only covers so many sessions, and then they need to quote unquote graduate and move on. And the assisted stretching service that we offer through Stretch Center, and our licensing model outside of our existing clinics essentially does that. It helps people transition from one service to another, and it gives them a reason to maintain the care that they received when they were on a treatment plan back when they had an issue or a complaint. And it's also preventative care. So it helps prevent injuries long term. And so people see that and they really appreciate and like those services because you're also thinking about them and giving them ways to help prevent injuries long term.
Yeah, and another way to scale is, and we've said this in many different episodes, is you really need to sit down and create a vision for what your end game looks like. If you have your dream practice, what does it look like? And that can help give you a roadmap to scale. Again, it's what it looks like for you, not what it looks like for me to tell you or some other consultant on what you should do. What's it look like for you? And then you can scale accordingly. So take some notes. If you don't have a vision for yourself, you're not going to know how to get there. So make a detailed list of what that looks like. And the idea of scaling and when to scale will become quite obvious.
Well, and if you're listening to this and you're in a chiropractic or physical therapy business and you're thinking about growing or adding additional services or trying to scale something, and maybe you're not that visionary person, but it's something that your business needs, don't hesitate to reach out to us because we work with people on helping them with their vision and how to grow and how to scale, as opposed to we don't just have a program where we put everybody in one box. It's really more or less we hear what you need and what you want and help you get X, Y, and Z. And maybe we don't do everything, but we will help you get the resources that you need in order to be successful and add those existing services. So Jeff is very much a visionary. I know we've talked about this in other episodes, but if you're thinking about adding services or you've thought like, hey, I read about or I saw or I know somebody who does this, what do you think would be good for me to do? Jeff can help talk through a lot of those things to see if it's really something that you would be passionate about. Because keep in mind, when you add a new service to your business, there is going to be a down before it goes up. And so you're going to have to be prepared for that and understand how to handle that. And there's going to be some work involved.
What do you mean there's going to be a down before that goes up? What do you mean by that?
Well, I mean, there's going to be work before you start profiting, right? Maybe it costs money to add an existing or add a new service. And so there's expense that may go with that, or you have to hire somebody before it shoots right up and it does really, really great. So sometimes there are some things that you have to overcome before you see a lot of those positives. But as long as you tackle it the right way, it almost always comes out great on the end.
Yeah, your vision should be your priority, is what Kristin is saying. And something that I think is so important to consider. So many people are afraid, justifiably, they're afraid to make an investment, and
they don't want the trade-off.
I've seen it so many times. Like I see people go buy these $30,000 lasers and these shockwave machines and spend just a ton of money, and they don't bat an eye because they think these machines print money. And the only way you can ensure a return on your investment is to invest in yourself. Take a gamble on yourself. That's the only thing you can really have control over. So what I like to do when I help people determine whether or not something is a good idea or not, let's look at what is the return that we should expect here. Like, what if it goes right, what does that look like? And then I evaluate the cost to implement whatever that is. And man, if that's a healthy return, let's frickin' go. If it's just like, if it's all right. No, we don't even look at it. Don't look at the cost of something. Look at the return that you can get from it. But be careful. That return or that implementation, I strongly encourage people for you to have control over the outcome, not a machine.
And do research.
Not a machine.
Do research.
Machine. I don't care. I bought so much bullshit over the years that just sat and collected. You can, I just got off the phone with this guy. So I inherited this piezo wave shockwave, which it's cool. There's no doubt about it. It's neat and it helps people, but you're not charging $250 for a 4-minute session.
I know.
But these manufacturers are like, you can bring in $30,000 with, 10 patients a month. No, you can't.
No, you're not.
You can't. It's just a sack of shit. So, excuse me. My point is, invest in things that requires knowledge and requires you to execute, not a machine or anything like that. Things that can bring you a return in perpetuity. When that machine goes to shit, you're going to not have a return. But if you have an idea, if you have a concept, if you have a model, for example, I'll just bringing in PT and incorporating PT, that will last you in perpetuity, right? Mm-hmm. A PT leaves, you get a new PT. Well, I guarantee you these piezo waves and these shock waves, mark my words, 10 years, they're going to be gone. It's going to be some other thing, right?
Not even. I was just at a leadership seminar, and what's interesting, we were learning about the hospital systems locally here, and they were saying that by the time the hospital purchases a piece of equipment, sometimes like we're not talking like 10, 20, 30,000. We're talking like millions of dollars. There's already something new being prepared to launch. And so think about that. They're spending that much money. Now, I do understand in the hospital setting, there are some really important things, but yeah, Jeff and I go to some of these places and talk to some of these people, and they tell you one thing and it's just not realistic. So if you are interested and you're not interested in adding like a service per se that a person does, and you're thinking about like a product, like the piezo wave or laser or something like Jeff is mentioning, do your research. Call people randomly that you can Google and find that have this in just random areas, and just get on the phone with a couple people and ask them, what are you really collecting per visit? And how many people are you really bringing in for it? And then how many people are actually getting results from it?
So I got off the phone with this guy the other day who markets Shockwave, and I told you I have one that I inherited, and he wants to charge me $5,000 a month, guarantee 20 to 40 clients a month. That's a big range. And if they don't produce 20 or 40 clients a month, they just extend the contract, which, by the way, I have to pay for the ad spend. I said, well, I'll tell you what, give me 3 of your biggest clients, the most successful clients you have, and let me talk to them. And, he messaged me back and said his clients aren't comfortable doing that. Well, it's pretty clear it's because there aren't any that are doing the numbers he said they were doing. So, and I didn't need him to tell me that. I've been around long enough to know the truth. But, the moral of the story is, if you have cash to burn, those technologies are great. We have some of them. Do we charge, do we get a rate of return on those things to pay for it? Maybe. But where we do get a rate of return on when we build systems that help develop results and repeatability and efficiency, that's how you scale. Don't scale with these technologies. That's a poor way to scale, and it's not going to last long. So you can tell Kristin and I are big proponents with chiropractors adding physical therapy because it literally doubled our business. And I can share with any one of you all the things that has done and continues to do, and not to mention the growth that it creates for chiropractic. But I highly urge you, if you have a little space, it doesn't have to be big, extra 600 square feet, 700, any extra space to add another provider, I encourage you highly to reach out to myself or Kristin, and I can help you navigate what that looks like and determine if it's a good fit for you, because I really think that we need to marry those two professions under one roof, because the results are amazing. The return on investment is amazing. It creates convenience for the client. It creates compliancy with insurance. So, yeah.
And it helps you develop more relationships in the community, not only with community members, but also other providers in the community, like orthopedic surgeons and whatnot, because you're offering more things that they can relate to.
So, well, it looks like we're running out of time here, but I hope that was fruitful. And any questions on how, when, or why to scale, feel free to reach out to myself or Kristin at sevenfigurechiro.com. Love to hear from you. Until next time, keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of Seven Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a seven-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.